know if you had thoughts about screening everyone for lung cancer.
Yeah. I mean, I've been thinking about this for a long time because I have to say, when I was at Mount Auburn, I did a lot of breast cancer. And when patients would get their simulation for breast radiation, they do a CAT scan. And there were many patients where we found lung nodules that were actually primary lung cancers in never smokers and younger women sometimes, that we wouldn't have otherwise found. And it's because the radiologist actually read all those CT scans.
Right.
And then I became involved in their pulmonary nodule clinic there. And so I was kind of doing both things. And so I've been thinking about that for a long time because we just saw it in practice, picking up these early lung cancers. I think that there may be a place for it. I think the tricky thing is that, as you know, we'll pick up a lot of things that are nothing, and then that leads to more scans.
The so-called incidentaloma.
Right.
Yeah.
And I
That's like
think
half my
that's what
job these
happened.
days.
Right. No, I'm sure it is. I'm
Yeah.
sure it is because people go to the hospital, they get admitted
Right.
for something else, they get a scan, and then you're stuck
Right.
following. And so, and then we have to think of the long-term radiation exposure. I mean, the screening CTs that we do for lung cancer are low-dose screening CTs, so there's not as much radiation exposure.
But there's still a good amount. I mean, that's a lot more
Yeah.
than like an X-ray, or like an airline flight,
Right. And so over the long term, over years,
You're
right,
right.
we have to think about that piece too. But I think maybe we can be, maybe not everybody, but we can find some populations that maybe we should be screening at, X age or whatever. But I mean, I've definitely seen it. And then the other thing is really young people getting diagnosed with colon cancers. I mean,
Yeah. Yeah.
I've never seen anything like it,
It's
like I have
unbelievable.
recently.
You treat colon cancer too, right?
Yes.
Yeah.
Yes.
I mean, I'll tell you right now, I was just talking to a patient about this today. In fact, like I think within a few years, you're going to see the colonoscopy start at 40. Not, we just lowered it from 50 to 45. And the only thing I think the reason they haven't done it yet is because I don't know if we have the providers to handle it.
To do it.
I mean, that's the problem. The screening colonoscopies are like, I can tell you, we're booking out oftentimes 6, 9, 12 months, right? So, but I definitely think, I mean, the colon cancer is another big thing, but I mean, with the CAT scan for the chest, it's like, it's such a minefield because we pick up all these nodules. We don't know the significance of them. All I can say on this one, Erin, is I hope the robots save us. I really hope that AI
that might be the one thing. Yeah.
Right. That somehow they can figure out who should be biopsied, who shouldn't be biopsied when we pick up these things, because we do, there is a downside to taking a picture of everything.